Okay, so I'm going to go through the resources that I have used for my physician associate preparation. I have done the MSc one, and we have had kind of end of year examination, OSCE MCQ, and then I have just done my national examinations and waiting for my results. So I will just go through kind of the resources that I have used, and I wish that these are the resources that I knew before at the beginning of the course, which I found really, really useful in terms of preparation for the Physician Associate National Examination, and then also for you to pass your MCQ and also your OSCE for the end of year exams for your university. So I'm going to go through the main ones that I found really, really useful. Obviously, there are other options available, but these are basically the main ones that I've personally found really, really useful in terms of preparing for my MCQ and also for my OSCE. So the first one is what we call Plabable PA, so Plabable for Physician Associate. This is a online platform, and as you can see, you can see kind of how much that you have to pay. So this one is subscription wise, £20 for 3 months or £25 for 5 months. They also have some gems, which are kind of like a small concise flashcards, and those are very, very useful if you're someone who likes images, colorful images, and also if you are someone who wants a bit less information in one concise way. So it has a lot of the high yield topics, the diagnosis management, and the brief about the pathophysiology. I found that very useful. Okay, so as you can see, it's very concise, and the main thing is that all of the topics in the gems for each of the subtopics, they're very, very high yield, and as long as you remember kind of the diagnosis, the management is very useful. Going on to kind of the question banks. So also just to remind you, for the gems, you will have to pay a extra of £10, and this will be for the number of months that you have to pay for the subscription. They also have some webinars. Also, I have not joined the webinars myself, but that's something you can try yourself. They sometimes release their own PA revision courses in which you do have to pay. And then, of course, the gems. For me, the gems and also the question banks were basically the main thing that really was useful. And they also have some OSCE mastery webinars that you have to pay as well. So I would say keep updated with those things and do try them if that's something that's going to be useful. But for me, I mainly use the question banks and also for the gems. So if we kind of have a look at the question banks now, so we can see here an example of paracetamol overdose, and on the top you can see of the topic gastrointestinal 1A. So for physician associates, you do have the blueprints, and I'll go into that a bit more detail if that's something you guys want. With the 1A topic, there's the more high yield topics, and there's 1B and 1C as well, which are less high yield. And this one again is obviously this patient have an overdose of paracetamol, and they will have to be admitted to the medical ward and give an acetylcysteine, which is the antidote for paracetamol, and also do an ABCD approach, and then think about psychiatry assessment if required. This is a 1A topic, which means it's something that you have to know in detail. You have to know the management, the diagnosis, a bit about the pathophysiology of the condition, and it's something that's very, very common, and it's something that you are likely to see in your medical career as a physician associate. And the good thing is with Plabable PA, they also have a section where they have a very concise notes, like past medicine. We'll go into past medicine in a bit, but you can see that the notes are very concise, and they're very exam related. So for the MCQ, you will get obviously questions, and majority of the questions are going to be from the 1A topic, and they're going to be very high yield. And as long as you remember kind of the basics, it's very useful. Now moving on to the second top on the rank is past medicine. For past medicine, there are different sections, so I would suggest use the medical students finals, this one. And in terms of the subscription, this one also you have to pay, and for 4 months £15, 6 months £20. This was very, very useful. This is unlike Plabable PA. Is So with the past medicine, this is more targeted towards medical students. So there is going to be a lots of topics which are not very high yield, and it's something that we don't need to know as physician associates. So I suggest that try and avoid those topics. That's a mistake I have made on my first year, is I was focusing too much on the low yield topics. So even in past medicine, when you log in, there is a section where you'd be able to see like kind of choosing the high yield topics. And the thing about past medicine is that you can repeat those questions over and over again with the same subscription. But on the other hand, with Plabable PA, you do have to pay each time for the questions. So once you have done the questions, you can't really repeat the questions again, unfortunately. So let's say you have done those questions, you can go and review them, but you can't redo them. Whereas in past medicine, you can reset the whole thing and do it again. Moving on to the third in the list is Geeky Medics. So with Geeky Medics, this was one of the best resources I have used for preparation in terms of OSCE. This was more useful for OSCE than the MCQ. Also, I would highly suggest you use it for the MCQ as well. The notes are also very good. Now on the top you can see that they have all the different sections. With the examinations, you have all possible examination that can come in physician associate OSCE exam, and you have the abdominal examination, which is very common. You'll have cardio, resp, you have all your orthopedics, you have your mental state exam, you have your peripheral vascular examinations, cardio exams, and all of that is there. They also have a very good platform which is called the virtual patient. So in this case, obviously with examination, you will have to do it on someone, or you can just practice it on pillow or a teddy bear. But with some examination is 3 in 1, so you will have to kind of take a brief history from the patient initially and then do the examinations afterwards. You can time yourselves. As you can see, I'm kind of speaking with the AI model, and they're very quick, and the way that they answer the question are very specific to what you're asking them. So it's a very good replicate when you're preparing your OSCE on your own. And then obviously there's a mark scheme for you that you can mark yourself at the same time. So this platform, I found it very useful. Moving on to the next section, which is the history. So again, they have all possible histories that can come up in the exam, starting from your back pain, the most common ones. You'll see some histories are so common that sometimes they have 16, 18 station on one symptom. In this case, you can see for abdominal pain, they have nearly, I think, 20 or 25 stations, which is again very you can also mark yourself. There's also examiner questions at the end, and you should definitely go through those questions because they can come up, and it's a good revision for your MCQ as well. The Geeky Medics mark scheme is very good when you're self-assessing yourself, but I would suggest using the red book that I have mentioned before. I think the mark scheme from the red book is much more similar to the national exam. The way that they mark it is much more specific than Geeky Medics, but nevertheless, Geeky Medics is also very good. But I would say use a combination of different resources. So with the blue book, the red book, Geeky Medics, Past Medicine, Plabable PA, and there's also another one at the end that I will mention, which is PA Matrix as well. Again, I'm showing another section, which is the counseling. You have all the different counseling that can possibly come up. Breaking bad news, for example, is very common, and you have 9-10 stations on that. You also have cervical smear counseling there, and you can see there you have the virtual patient. Usually with counseling, you don't really need someone to speak to you because counseling is majority of the time you're talking on your own. But again, if you're practicing on your own and you don't have anyone to practice with, then you can use the virtual patient to kind of do the practice, and then you can mark yourself. The mark scheme is not very specific with counseling. It's quite general, like it needs to be chunky. Make sure you pause in between. Don't try and speak to the patient in a non-jargon manner. And then at the end, you can see contraception is a very common topic, ethical topics, diabetes. Moving on to interpretation, again, you have blood test, the common interpretation, you have so many of them. So for example, in this one, like blood test, you have like 11, 12 of them, and you should time yourself, try and interpret it and explain it to the patient in a way that they do understand. It's always good to kind of tell them the normal range and then say how that differs from the normal range and address any concerns and questions that the patient might have. Moving on to the next in the list is PA matrix. This one is very good. However, I did not have that much time to use it myself, but I would highly recommend that you use this one for your MCQ preparation. This one, I don't think there is any way you can prepare it for OSCE. However, this one is very useful for your um, MCQ preparation. They have high yield topics and they have questions that you can practice over and over again. So that's end of the list. So these are all the these are all the resources I have used throughout, and of course the mark scheme for the red book and also the blue book is something I have discovered much later on, and those were very useful as well. So that's basically my advice.